So as you see, we have three really excellent panelists, and I would just want to wade right into the questions so we just get into it. So I want to start with you, Maria. I want to ask you about the WHO Manifesto on Healthy Recovery from COVID-19. You know, this pandemic is dominating the news, dominating talk in public health. So I want to start with this. How is the manifesto going to help us get out of this and recover?
Thank you. Thank you for the question, and a pleasure to be with all of you. Clearly for us, it was a question of keeping fighting against the virus, but start to prepare for the recovery and for making sure that while fight the virus, we start to take lessons from what we have learned. If we want to be successful on reducing the vulnerability of our society for the next crisis, and the next crisis is climate change, and it will be really huge, or even reduce the probability of having again another big pandemic, we need to go at the source. We need to go upstream. And that's why we decided to do the manifesto. The manifesto is extremely simple. There are 6 prescriptions. Since we are talking a kind of medical language, we decided to have a good diagnosis and then going for the prescriptions. And the prescriptions are nature, recover our relationship with nature, provide basic services like water and sanitation, make sure we have a healthy energy transition as soon as possible and as ambitious as possible. The food systems needs to be more sustainable from the beginning to the waste management. 5 will be our cities. I mean, this is the perfect laboratory where we can be very successful on reducing the vulnerability of our citizens and protecting them and promoting their health at the urban level if we have a healthy urban planning. In the last one, the number 6 is a very provocative and politically quite heavy. We are asking countries to stop paying subsidies for fossil fuels, because fossil fuels are killing us, and this is absolutely unacceptable, and it's creating again this big vulnerability for yet another infectious agent threatening us, or the big environmental challenges that we need to face quite soon.
Indigenous groups are also making these alliances around the world. There's kind of doing end runs around the old institutions. Is that the way ahead for Indigenous groups as well, or do you have to do both?
I think we have to do both. We focus in our work on what we call the roots of wellness, and some of them have been mentioned, you know, clean water, clean air, connection to land, culture and tradition. But we also have another layer above that, that is education and housing and the transmission of traditional knowledge. Those are all pieces. When we talk about fire season in BC, the work that the elders had done previously to prevent the conflagrations that we've seen, people aren't listening to them. There is significant knowledge at the ground level. So while people are becoming more empowered and more political, big P political as well as small, there's also a sense of needing to turn around and put your feet on the land, on the territory, because that's where your truth is. And until you have that, it's very difficult to speak in those halls of power with people who don't recognize your sovereignty and jurisdiction around those pieces of territory. So I think there is a global arena, absolutely, a collective voice, hopefully more and more. But the real power of change for many of our communities is what's happening on the ground, and in the band offices, and in the small P political arena, where we're seeing communities take power and control over the trajectory of their health, and that empowers people who take it further to, you know, the social determinants of health and political determinants of health that we're talking about.
Now you could weigh in on the manifesto. Do they have the priorities right? Is this the way out of this global pandemic?
No, I think the priorities are right, and in fact, they're very much what one would expect to see there, and I'm glad, I very much welcome them. The challenge is, of course, how do we take them forward in a world that is becoming more and more difficult? In many ways, it's really rather bizarre because the evidence is there in front of us. You know, if you are on the on the west coast, you can see the forest fires. If you were in Australia, you can see the forest fires. If you were in Africa, you have the plague of locusts. You know, it's almost as if we've got a bingo card where we're ticking off the plagues of Israel one by one. And yet we have a complete lack of any real determination to do anything about it at a global level. I mean, of course, there are many countries, many politicians who are, but it's all rhetoric. So that's the challenge. So I think it's great, but we now need to find a way in which we actually make this happen. And, you know, maybe we will talk about this more, but essentially, if we don't, we are destroying ourselves. We are committing genocide on ourselves. And this is where we have a challenge, I think, in the international community. Because, and I don't want to stretch the analogy too far, I realize the limitations and I realize the concerns. There is in international law a responsibility to protect, which allows the international community to intervene where there is a government that is committing genocide or where it is significantly harming a group within its population. I think that we haven't actually moved the international architecture, the international legal system far enough forward to you know, what do we actually do at the minute with Bolsonaro, who's setting the Amazon on fire? This has implications for the planet, and we don't have an international mechanism to deal with this. And I think that we actually need to collectively think about what that will be. It may be a little bit easier after November, fingers crossed, but it's a challenge for us all.